Good evening, friends.
Good evening.
Thank you for coming this evening for hopefully a very interesting talk on a response to emerging infectious diseases in the context of urbanization and global warming. Where is the science gone? And just to give the context to why we chose this topic, and of course, we have a French speaker today. So I must credit this to my colleague, Dr. Adele, who was quite instrumental in suggesting this topic for this very interesting speaker that we will be introducing shortly. So on this, today happens to be the Earth Day, and what better way to celebrate sustainable nature and environment than to have this topic. And we have with us, we have this special emphasis given by both India and France for doing collaborative research, which are also, for societal needs to understand how emerging infectious diseases spread in the urban context. So I'm pleased to welcome Dr. Olivier Tell to this monthly lecture series of STIP Forum, where 6 of the organizations represented on the board here take turns to organize this lecture. And we have this very young researcher amongst us who is, I'm very pleased to introduce him to you. He's an urban geographer at CNRS France, and he's currently leading the territorial dynamic acts of Centre de Sciences Humaines and is affiliated with Center for Policy Research, Delhi, as well as a visiting fellow. His research is to better understand how global warming and socio-spatial dynamics of cities are connected to epidemic diffusion, especially focused on our own city, Delhi. So please join me in welcoming Dr. Olivier Tell. And he will be shortly delineating his research work in the context of urbanization and global warming.
Thank you, Dr. Rupal, and thank you, Dr. Salunke, for your very kind introduction. So indeed, my name is Olivier Tell. So I am researcher at CNRS. I started working in India 12 years back when I started my MPhil in India. I wanted, first of all, to work on, the relation between water access and classical disease such as cholera, etc. But when I reached India in 2006, Delhi was facing one of the first most important dengue epidemics. And the journals were locating this epidemic in South Delhi, which for me as a geographer would not make sense. So I will explain you that later. So I find interesting that, everyone has studied before the geography of classical disease such as malaria or cholera, etc., plagues within city, but no one really studied the geography of emerging disease, because dengue is what we call emerging disease, which means it was not very much present here 30 years back. And now all major cities situated in the intertropical belt are affected. So I decided actually to entitle my talk Response to Emerging Infectious Disease, Where is the Science Gone?, to kind of summary 12 years of experience. It's quite short, but I think it was interesting for me to try to summarize everything I've been through. So indeed, I'm a social scientist. I worked as well at Institut Pasteur Paris, so an Institute of Biology and Immunology. So I can say that it was hard for 3 years for me to learn new concepts, but it was very useful, and I hope this talk can summarize this and can show the interest of mixing science together. This is the map of the PhD I conducted. So actually what you are doing here, you are mapping the density of cases over 3 years, 2008, 2009, 2010. As I say, for 2008, 9, and 10. And we have several interesting information here. So we have only, for example, 1,200 cases in 2008, 2009. So we could think that the disease is stable. But while realizing, mapping these cases, we can see it's not the case. We have the same numbers of cases, but the geography is completely different. South Delhi was not affected in 2008, while it is clearly a hotspot in 2009. West Delhi was affected in 2008, what previously it was not hotspot in 2009 and 2010. This is a very important information for geographers like me. It is clearly a new model of spread for diseases. Naturally, epidemic were stable in time. That means the area being affected 1 year, where most probably the area affected the years after. Here we can see that over a year, the geography is changing very fast, which means that it's very difficult for the municipalities to predict the next epidemic according to the past one. We can see as well that the relation with socio-economic environment is clearly not defined. South Delhi is where the, let's say, the well-developed area are located, and we have actually high numbers of dengue cases in 2009 and 2010. This is the second important change. This is a new model of health geography that we could discover in Delhi actually. So this is done by surveillance system. And in 2013, we got INR project funded by French, and we work with ICMR, Indian Center for Medical Research, to go on field and test population for past antibodies and recent antibodies. So we went in 18 colonies of Delhi. We tested 2,100 individuals in 18 colonies of Delhi, according to several socioeconomic categories. So you can see we went in Mohammadpur to JVR, going through Rajouri Nagar, etc. And we tested them with rapid diagnosis tests to understand if they were presenting some recent antibodies. That means it will tell us that someone has been affected 1 month before, or if they presented IgG antibodies, which means the individual was infected at least once in his life. And this is the result we have on the right. I don't know if it's clearly the case. So NIMR, National Institute of Malaria Research, conducted as well some vectorial indexes. That means they did tremendous amount of work to visit 10,000 houses over a 12-month period in 2013, and they could detect actually that Aedes aegypti was much more present in the impoverished high-density area in comparison with the, let's say, richer area, the well-planned area. We have, for example, 10% of the houses which presented Aedes larvae in impoverished high density, while we have only 4% of houses controlled positive for Aedes aegypti the same years. So we could think that the geography of the disease, the incidence rate will follow the same pattern, but it's not the case. You can see here the percentage of population that presented past antibodies of dengue, and it's around 40%, if I'm not wrong. Yeah, 40% of the population residing in this impoverished high density were affected at least once in their life. And in rich area, in a well-planned area, we are around 30%, 35%. So it's kind of confirmed what we could see through the surveillance system. There is clearly no link between social disparities, social-spatial disparities, and the infection rates of dengue. This is very interesting as well, these things. Just to tell you, actually, we could find that 40% of people were actually confirmed positive for dengue in Delhi, which is not a lot, actually. In Bangkok, it's something like 90% of people. So that means there is more space for dengue in Delhi in the coming years. And clearly, actually, we say that Delhi is the capital of dengue. Actually, no, Delhi is the capital of dengue because the surveillance system is very well planned here.